I remember seeing younger girls in the waiting room. There was one young girl in particular. I didn't want him to fuck up her life too.
All good? All good.
Dr. Simon Gordon sold himself as a top gynaecologist for endometriosis.
I trusted Simon Gordon with my body. He took my finances and my trust in the system.
Once the busiest laparoscopic surgeon at Melbourne's Epworth private hospital, Dr. Gordon was notorious amongst his colleagues for performing aggressive surgeries on young women.
There was no endometriosis found in the pathology report. I was shocked. I felt so violated.
Simon Gordon has destroyed my life. It is completely changed from what it should have been at this time.
Patients had tissue and reproductive organs taken out. The question is why?
I had both my ovaries and my uterus removed by Simon Gordon by the time I was 25.
Dr. Gordon has been gynaecology's open secret. The medical regulator and management had been informed about him many times.
I want them to understand that they could have put a stop to this so much earlier.
I'm not sure I've seen a more distressing series of allegations about care.
After a 7-month Four Corners investigation, doctors are speaking out for the first time.
I hope this will be a changing point for us in medicine where we do not blame the people that speak up.
Why do you think this hasn't come out?
I think most of us are scared.
We've shared women's medical records with leading gynaecologists who were shocked by what they believe is unnecessary surgery. In this episode of Four Corners, we investigate a top Melbourne surgeon who repeatedly removed healthy tissue and organs from young women at Victoria's largest private hospital. Why didn't multiple complaints to the hospital and regulators stop him? And what lessons can be learned to prevent this from happening in the future?
So we'll just start off with it. Almost like jump into that whole cross.
Yeah.
Beautiful. And again.
Mary Spanos refuses to be a victim. She's fighting back.
I wouldn't be able to live with myself if I didn't come forward to try and prevent this from happening to other people.
Mary was diagnosed with endometriosis, a disease affecting about 1 in 7 Australian women, where cells similar to the lining of the uterus typically grow in other parts of a woman's pelvis, causing extreme pain and, in many women, infertility. Her first surgery was with another gynaecologist, and she had superficial endometriosis at that point. But the surgery didn't make the pain that Mary had suffered for years go away. And in 2020, when she was 26, she decided to go and see Dr. Simon Gordon.
He was the person that was on all the Facebook groups, all of the, Instagram pages that I followed. He was listed as one of the best in Melbourne. He was, honestly, in that appointment, one of the most charming people I've ever met.
Simon Gordon advised Mary to have a laparoscopy, keyhole surgery to inspect her pelvis and remove endometriosis. Mary says he fiercely criticised her previous surgeon.
He was pointing to all the images saying, yep, see, that's endo, she's left this behind, that's been left behind. I'm so glad you've come to me, we're going to fix it all. Look at all these spots, I'll take them out and then you'll be good as new.
And were you?
No.
Mary woke up at Epworth Freemasons Hospital with excruciating pain she says she hadn't experienced after her previous surgery.
Mum and I are both crying. He's saying, it's all confirmed. It was all endo. We got rid of it, so she's going to be amazing.
Despite Dr. Gordon's promises the endometriosis was gone, as the weeks and months passed, Mary Spanos did not feel any better.
I was in debilitating pain. I'd gotten to a point where I'd purchased a walking stick because I could barely stand up straight. These are the pathology notes.
Mary demanded to see all of her pathology results to see what was really going on.
There were 5 separate pieces of tissue that had been sent off to pathology, and all of them came back saying no endometriosis present. And his handwriting was right next to it saying nil. I just broke out in a sweat, broke out in tears, and I just was in shock.
So to be absolutely crystal clear about this, you're saying that he lied to you?
Absolutely.
These are just some of the women we've spoken to about Dr. Simon Gordon. Some have had several laparoscopies with him. Some have had ovaries removed, and some have had their fertility compromised.
Hi, I'm Dr. Thierry Van Kai. I'm a gynaecologist since 1985 and a pain medicine specialist since 2010.
Professor Van Kai is considered one of the fathers of laparoscopic surgery in Australia. We sent him Mary's medical files. He said while Dr. Gordon claimed clear evidence of extensive scarring in Mary's pelvis, this was totally imaginary, and there was barely any.
Your words to us were, in my opinion, the surgery performed by Dr. Gordon was totally unnecessary and caused more harm than good.
That's correct, yes. Yes, indeed. In someone who has a almost clear pelvis, it's really sad to see.
We've spoken to dozens of gynaecologists for this story. They say that occasionally you can do a laparoscopy genuinely believing that the woman has endometriosis, and then when you operate, you realise that there was actually none. And so, of course, you immediately tell the woman the truth. But as our investigation progressed, we discovered that Simon Gordon was allowing women to believe after a major operation that they had severe endometriosis, when in fact they had little or none. And he was doing it again and again and again.
I'm Dr. Desiree Yap. I'm a specialist obstetrician and gynaecologist. I've had a fairly constant trickle of patients from Dr. Gordon in the last 15 or so years.
Melbourne gynaecologists we spoke to, both on and off camera, confirm they've seen patients whose pathology results don't show endometriosis, when Dr. Gordon has told them they had a severe case of the disease and operated as if they did.
I then have to weigh up what is in the best interests of the woman about the problem that she is currently seeing me for.
That sounds like a stressful situation to be in as a doctor.
It is. I personally take a, harm minimisation approach, so I don't want to distress a woman when I don't have a solution.
I'm Shamitha Kadrasinghe, gynaecologist, working in Melbourne, Australia.
What does it say when a doctor tells a patient that they were riddled with endometriosis when the histopathology shows otherwise?
I think we're deceiving our patients.
Have you had patients whose operation notes from Simon Gordon say they have endometriosis, but the histopathology shows they don't?
The short answer is yes.
On multiple occasions?
Yes.
Does that worry you?
Yes.
We asked Jess Foster to check the histopathology for her surgery. She had mild endometriosis during her first surgery with another doctor, but she's now discovered there was no trace of the disease on Dr. Gordon's pathology samples. Dr. Gordon diagnosed Jess with deep infiltrating endometriosis shortly after he received these results.
After I got out of the surgery, I woke up and it was instantly just this blinding pain. Like it was, I can't even explain to you how bad this pain was. I actually just asked the nurses to kill me. I just said, I can't take it. I said, please just kill me. I can't take it. I can't do it.
Before she met Dr. Gordon, and even after her first operation with the other gynaecologist, Jess had a very different life.
I was an incredibly active person. I went to the gym 6 days a week. I was a pole fitness instructor.
She's now in constant pain.
I am terrified of that pain. I am terrified. So at the moment, I have to take up to 50 milligrams of opiates a day, 200 milligrams of ketamine, and I barely even took Panadol before his surgery. I can't exercise. I can't go to the gym. I can't work. I have barely any quality of life compared to what I had before.
And that's because of the surgery?
And that is the second I got out of the surgery with Simon Gordon, my entire life changed.
After our interview with Jess, she complained to the medical regulator, AHPRA. Its investigation is still ongoing. Dr. Gordon often performed a major surgery with the item number 35641, which Medicare rebates for severe endometriosis. We asked gynaecologists when it was appropriate for a surgeon to perform and bill for a 35641.
I'm Dr. Alice Whittaker, an obstetrician and gynaecologist with experience in public practice and private practice. So this billing is really reflecting someone who has very advanced endometriosis. So to be eligible for this item number, you need to demonstrate that person has had severe endometriosis.
Dr. Alice Whittaker understands the pain of endometriosis because she's had it herself. But she points out that about 80% of endometriosis in women is superficial freckle-like spots on the lining of the pelvis and manageable without needing surgery.
They don't need to fear that their endometriosis is going to progress and they're going to be left with major disease down the track.
So in the second screen we have an example.
Severe endometriosis is relatively rare.
This is the vaginal probe.
Dr. Karen Mizier is a gynaecologist who specialises in ultrasounds.
Deep endometriosis is where the endometriosis has burrowed into the pelvic floor tissues or to the tissues in the pelvis. And there's a chance that it has invaded into either bowel, blood vessels or other tissue, and then excising that is going to be much more complex compared to superficial endometriosis.
Medicare's item number fee for a 35641 is $1,449, more than any other endometriosis surgery. Some of the patients we spoke to had more than one of these operations with Simon Gordon. Is it ever acceptable that a 35641 laparoscopy be conducted in circumstances where the histopathology shows no endometriosis?
Absolutely not. Hi, I'm Dr. Peter Wright. I'm a gynaecologist working in Brisbane. The current evidence does not suggest that laparoscopy and excision of endometriosis is a good treatment of pelvic pain. So I always say that surgery can diagnose endometriosis, it can remove lesions, and it may or may not improve pain.
Look, I think surgery can be a really important tool in the management of endometriosis-associated pain. But when it's used repeatedly and used inappropriately, particularly in the context of chronic pelvic pain, it can be unhelpful and frankly harmful.
So that's endo, right there. There's a scar tissue from previous surgery.
Professor Van Kai reserves a 35641 surgery for only very exceptional cases.
It is performed in cases of extensive endometriosis involving indeed the bowel and the ovaries, for instance. It's so the exception rather than the rule, really. So that's why it's a special category.
Does it concern you that there are women having tissue removed unnecessarily?
Absolutely, because I see the consequences of it in terms of pain secondary to surgical intervention as a pain specialist. So yes, my thinking is that surgery should be kept to a minimum.
Professor Van Kai also agrees that telling women they have endometriosis when the histopathology shows they do not is unacceptable.
That's not right. That's for sure.
We went to Canberra to speak to the Federal Health Minister, Mark Butler, about the complaints we've received about Dr. Gordon. Have you spoken to your department about an investigation by Medicare into this particular doctor?
Well, I've got advice that those investigations are underway.
So there's an investigation by Medicare?
On Medicare billings, yes.
In his statement, Simon Gordon told Four Corners, "Over my 2.5 decades as a specialist, Medicare has never contacted me about inappropriate billing." Dr. Gordon charged higher out-of-pocket fees than other gynaecologists Four Corners has spoken to, both on and off camera. Some of the patients did not have private health insurance.
I actually had to access my super, my retirement, to pay for this surgery.
The surgery cost me more than $14,000. My partner had to take out a personal loan to help me fund that surgery, which we're still paying off until today.
Oh yes, I can fix that. I can cure you.
Nicole Vanderzee did have endometriosis when she had surgery with Dr. Gordon, but she's still in physical and financial pain 4 years later.
Was the surgery successful?
To Simon Gordon, yes. In his words, the surgery went perfectly, but I'm actually in more pain post-surgery than I was prior to the surgery.
So there was no benefit as far as you could see?
Oh no, if I could tell my past self to not go through with it, I wish I could. I really wish I could.
So Nicole, these are your bills for the surgery?
Yes, some of.
So all up, how much did you actually pay?
For the day to be in hospital for the laparoscopy, it was close to $13,500.
That included the overnight bed costs, Dr. Gordon's out-of-pocket fees, and the anaesthetist.
I didn't have that money, so I needed to borrow, and thankfully I had family that I could borrow off without putting myself into a horrible debt, with a bank.
And you're still in debt for that surgery?
Yeah, I'm still paying family back, yeah.
Dr. Gordon has made an impressive living from women like these. He's been a golden goose for the Epworth. A few months after he operated on Nicole Vanderzee, Dr. Gordon paid $5 million for this property on Victoria's Mornington Peninsula. He also bought this slick inner-city penthouse, which is now for sale for almost $3.5 million.
I'll never forget this pin wall that he had with photos and letters, and on it was a handmade card that said, "I love my daddy because he drives a Ferrari."
So he's driving a Ferrari and you're in debt and not any better than you were before?
Worse. I'm worse than I was before.
Queensland practitioner Dr. Peter Wright doesn't know Dr. Gordon, but she knows other surgeons who also perform multiple laparoscopies on women despite clear national guidelines that advise exercising caution before doing repeat surgeries.
The people that do a lot of surgeries, their entire business is built on the surgery that they do, and they're great surgeons and they're good people. If they accept this science, then their entire practice has to change, and that's their mortgage payments, that's their private school fees, that's all of that. That's why this is such a difficult thing to change. That's why.
When gynaecologists discuss other pain options with patients like medication, physiotherapy, diet, the Medicare item fee for that consultation is $178, a small fraction of what a surgeon receives for a 35641 operation.
I think it's all set up because Medicare thinks that gynaecology is a surgical specialty and they give greater rebates to surgeries. There's a financial incentive to operate rather than to listen, validate without a surgeon's knife.
You have seen Simon Gordon patients who have had multiple laparoscopies.
Yes, I have.
The College of Gynaecologists and Obstetricians has guidelines, and it says that it recommends careful consideration for repeat laparoscopic surgery for people with endometriosis. Why is that?
Because there's no evidence that repeated laparoscopies solve the problem. I think that in the last 20 years we've really moved away from the idea that surgery is the cure for pain. My philosophy is more than one, you're done. So you want to do it once, you want to do it well.
I would say since 2015 I probably haven't had to repeat a laparoscopy in the same patient.
What are the dangers of continually removing tissue in this way?
Treating the patient's pain is less likely to be effective the second time around. So scar tissue indeed can cause pain, or indirectly, and scar tissue is definitely very difficult to treat.
I am anxious every time before I operate on their pelvis, and it has to pay dividends for that patient in terms of quality of life. Every time we cut, we have the potential to cause harm.
Simon Gordon told Four Corners, "Across my entire career, I never performed surgery to treat endometriosis or any other condition unless I was absolutely convinced it was in the patient's best interests and to improve their overall quality of life." Whatever Dr. Gordon thought, there were certainly clinicians at the Epworth Hospital who were concerned about his practices.
I had a pretty horrific onset of pain whilst at home. I'd only just been discharged from Simon's care, so we returned to Epworth Emergency Department to be seen. When they tried to contact Simon, he wouldn't admit me. He refused to admit me. He said, and I quote, "The emergency department is for people who are dying." It was pretty clear that the emergency department doctor was extremely disgusted in that behaviour, and she actually put through a formal complaint.
There were multiple complaints to management.
The complaints even came from doctors, an emergency physician and a gynaecologist working in intensive care complained to Epworth's Director of Medical Services because Dr. Gordon refused to see his own patients who were having medical emergencies.
Dr. Gordon says he was not aware of complaints. An Epworth fertility specialist intervened to stop Abby Lewis from losing an ovary. When we met Abby, she had recently become a mum.
I feel very blessed. I feel that he is my little miracle baby.
But it would have been much harder for Abby to conceive this little miracle had that fertility doctor not put a stop to Simon Gordon's plans. Dr. Gordon first operated on Abby when she was a teenager, and at that point she had endometriosis. By the time she was 21, she'd had 4 laparoscopies with him. Abby has only now discovered that in the last 2, there was no endometriosis present in her pathology, even though Dr. Gordon wrote in his operation report that he excised it.
I went back complaining of my left-sided pelvic pain, and from the start he had told me that my endometriosis was worse on the left side. So he said, now it hasn't worked, what we've done hasn't worked, so it's time that we're just going to have to remove it.
Remove an ovary?
Remove an ovary. My heart kind of sunk when he said it, because I was 22 at the time. It's a pretty big deal to be told that your ovary has to come out.
And from what we have found, speaking to other gynaecologists, it's not recommended for women in their 20s.
No.
Did he explain any of that?
No. There was no explanation, and any questions were shut down pretty quickly.
There is a reason why we have these organs in our bodies. For the ovary, other than fertility, an ovary plays a pivotal role in a person's well-being, their bone health, their menopausal overall general health.
So is it fair to say that you would only remove an ovary in a woman in her 20s in very, very rare circumstances?
That is correct.
Have you seen young women in their 20s who've had ovaries removed when the histopathology shows no endometriosis and there's no fertility preservation by Dr. Gordon?
Yes.
Does that concern you?
It concerns me because it is hugely different to how I would practice.
I would hope that actually doesn't happen.
He's a good sleeper.
Is he?
Yeah.
Wow, that's good for that age.
The fertility doctor who saved Abby's ovary was alarmed such a young woman was about to have an organ removed.
The main thing is...
He got a second opinion from a professor of gynaecology who agreed the ovary should not come out.
He was pleading with me not to remove an ovary at my age when there's really no need for it to go.
That doctor made a complaint to Epworth management about that.
Yeah.
The point is that that was one of many complaints that have been made to the hospital about this surgeon.
Yeah.
By doctors and by patients and by nurses.
Yeah. It's just disappointing that it's taken so long for anything to be done.
Epworth's Director of Medical Services says she cannot recall this complaint, but she did counsel Simon Gordon about another complaint. In September 2024, a professor of gynaecology complained with 2 other doctors to the medical regulator AHPRA. We suggest that you actually chase the pathology of the patients, as many patients who have been told they have endometriosis/severe endometriosis, but in fact have no pathology confirming this. And patients listed all had at least 1 ovary removed. I cannot find a colleague who takes out an ovary in a young woman under 30 except in very rare circumstances, for example, cancer. This surgical approach is outside of standard gynecological practice. Years after people first started complaining about Dr. Gordon, AHPRA has requested thousands of pages of his patient files from Epworth Hospital. On February 10, Epworth's CEO, Andrew Stripp, wrote to AHPRA requesting that the regulator inform hospitals in a timely manner if it was investigating doctors to safeguard patient safety. In a statement to Four Corners, Professor Stripp said, "To anyone who feels unheard or let down, I am truly sorry for the impact that experience has had on you."
From what you've seen, do you think that these women were let down?
Well, it goes without saying, these women have been let down by the system, and really our job now is to determine how we can ensure this doesn't happen again.
As we met more women and health professionals complaining about Simon Gordon's practices, we were contacted by a crisis communications professional for Epworth. That's when the hospital started investigating Simon Gordon and told him he'd have to go on leave. The CEO informed Epworth's board, and on that weekend, Dr. Gordon announced his retirement and cancelled all of his surgeries. By the Monday morning, Simon Gordon's rooms had been completely cleaned out. This caused chaos amongst his patients, as so many women were left without care. As this happened, Isabella Ganji was waiting for her surgery with Simon Gordon. Days before he retired, Isabella posted this video on social media.
I am having surgery on the 12th of November in a couple of weeks. He is going to remove my left ovary. If it means that I'm not going to be in any pain anymore, let's do it.
Isabella is autistic. We visit her in assisted living accommodation. Her family paid for her surgeries in the hope their girl could beat the excruciating pain she'd lived with for years. Dr. Gordon's retirement and sudden cancellation of Isabella's surgery sent her mental health spiralling.
When I found out he retired, I was very hurt and upset because he said that the surgery that I was going to have was going to completely fix me and take my pain away. I was very suicidal and I didn't know what to do anymore.
2 days after Simon Gordon retired, Isabella Ganji attempted suicide. Her GP referred her to see another gynaecologist who explained she hadn't actually needed the ovary removed at all and refused to take it out.
You felt suicidal on Monday about losing Dr. Gordon. How do you feel about him now?
Very angry and disappointed with him. He told me that he was going to be the one to stop all my pain, and I believed him, but I am just finding out that he was going to make me worse, makes me angry. I'm angry at myself for believing in him and thinking that I was going to get better.
You shouldn't be angry at yourself. You didn't make this happen, Isabella.
I should have asked more questions and I should have asked for more information. But all he said was it's going to stop my pain, and I believed him.
We travelled to Thailand to meet a young woman who wasn't saved by another doctor. A young woman whose case is absolutely notorious in Epworth gynaecology circles. Courtney Patton had 7 laparoscopies with Simon Gordon.
I've had the opportunity to have a family taken away from me. I'll never be able to get that back.
By the time she was 25, Dr. Gordon had removed 3 of Courtney's organs and rendered her infertile. It's left her deeply traumatised.
I've endured multiple surgeries for what I was told was to help with my endometriosis symptoms. I've had both my ovaries removed and my uterus removed, all on separate occasions. At one point it felt like I'd spent my 20s in Epworth. I ended up in the Cabrini Mental Health Hospital for severe PTSD from everything I'd endured with Simon Gordon.
From the multiple surgeries?
Yeah.
In the days before Simon Gordon suddenly retired, Four Corners asked Courtney Patton to email Dr. Gordon to request all of the pathology results from all 7 of her operations because she'd never been given that information before.
He said, "Hi Courtney, it's been a while. Hope you are well. Unfortunately, I cannot locate any histopathology for you. Your file appears to be missing or has been culled. Regards, Simon."
Doctors are legally required to keep patients' medical records for 7 years. We went through Courtney's pathology records, comparing them with what Dr. Gordon wrote in his operation reports. The results are simply shocking. This is your first operation in 2019 with Simon Gordon.
Yeah.
So let's have a look at the report then. Specimen 1, no evidence of malignancy. Specimen 2, no histological evidence of endometriosis. Specimen 3, specimen 4, specimen 5, no endometriosis is identified. And specimen 6, there is no evidence of endometriosis. How do you feel seeing those words?
Violated. Yeah, violated.
This is a letter to your GP?
Yep.
And he says it's entirely consistent with endometriosis. This is the billing for that procedure. This has been billed for advanced endometriosis surgery.
And there was no endometriosis surgery.
In February 2020, Dr. Gordon performed a second surgery on Courtney that was designed for severe endometriosis. In one of the 5 pathology samples, some tiny deposits consistent with endometriosis were found, but all of the rest were negative. 3 months later, Courtney had surgery number 3. No endometriosis identified in multiple levels. And what does he write to your doctor? Courtney has had a number of challenging surgeries for endometriosis. And again, he's billed you
for advanced endometriosis.
In January 2021, surgery number 4. This is an important one. Why is that?
Yeah, you took out my right ovary.
Okay. The pathology again showed no evidence of endometriosis. He writes to your doctor and he says, Courtney has a long history symptomatic of endometriosis. I mean, how do you feel about that now?
It's shattering because I put my trust with this doctor thinking he knew best, he knew what was best for me. He knew how anxious I was about not being able to have kids in the future.
And this is the beginning of the end of your fertility.
Yeah. And I was only 23.
Courtney spends her days trying to mentally process it all. She's now discovered there was no disease on her histopathology when Simon Gordon did surgery number 6 to remove her second healthy ovary. That said, it's not as if no one was worried about what was happening to this young woman.
As time wore on, there were serious concerns amongst the other medical professionals who were seeing Courtney. One of them raised the alarm to Epworth management that Simon Gordon had taken a second ovary from the 24-year-old Courtney without fertility preservation. Another doctor who saw Courtney at the time was so disturbed by the removal of that second ovary that she had to leave a consultation with Courtney and she burst into tears.
People were raising red flags all over the place, but nothing happened.
Nothing happened.
Four Corners has discovered that a clinician's complaint about Courtney's second ovary being removed went to Dr. Kate Tyson, then director of Epworth's Endometriosis Centre, and Dr. Julie Lamont, the director of its Women's and Children's Clinical Institute. Dr. Lamont emailed Dr. Vivek Nigam, then Director of Medical Services. The hospital's records don't show what happened from there, and Dr. Nigam can't recall it. While this was happening behind the scenes, Dr. Gordon told Courtney she needed a 7th surgery, a hysterectomy. Another gynaecologist warned that it was unnecessary. But then, in 2023, Courtney was hospitalised with a kidney infection. And Simon Gordon came to see her, convincing Courtney removing her uterus would relieve her pain.
When you're in my position, when someone's seen your insides multiple times over and over, and when you get so desperate for help, something in you just goes, oh, okay, I'll trust him.
Courtney Patton was 25.
It's devastating. He's taken the trust of a young, vulnerable woman and completely betrayed it.
We forwarded Courtney Patton's operation notes, pathology results, bills and some surgical photos to Professor Thierry Van Kai. He wrote back that he was shocked at what he saw. The treatment, or rather the mistreatment received by this poor patient, Courtney Patton, is unbelievable. How on earth could anyone justify this?
Something should have happened after the second laparoscopy, and in other words, the diagnosis was not correct anymore. I was sick to the stomach, really. It was sickening to look at. Beautiful pelvis to start with, and what happened afterwards.
How do you feel that no one stopped this from happening to Courtney?
Yeah, well, it's unacceptable, really. It feels like nobody wants to take the responsibility, or nobody knows whose responsibility it is.
I have to say it's one of the worst cases I've seen, one of the worst stories I've read as a health minister about care being delivered in what is otherwise a terrific healthcare system. I have to say I felt quite physically sick reading it. I mean, it's incredibly distressing.
Epworth CEO Andrew Stripp cancelled an interview with Four Corners for health reasons and declined to make his chief medical officer available. In a statement, Professor Stripp said the experiences being described were deeply distressing and the hospital had referred Courtney's case to AHPRA in October last year. He is now commissioning an external review of the hospital's clinical governance. Simon Gordon declined to be interviewed and refused to speak with Four Corners about any of these individual women's cases, despite them all providing consent for him to do so. More generally, he said, for generations, the pain suffered by women was ignored, downplayed and untreated. My concern was to try and alleviate pain and restore quality of life for female patients. Solicitor Emily Hart is representing Courtney and has now been contacted by more than 80 women treated by Dr. Gordon.
I don't think there is an amount of money that can properly compensate someone for the loss of their fertility, particularly at such a young age. What really shocked me when I first became aware of this matter was the way that Simon Gordon's practice differed so dramatically from other matters that I'd seen.
Again and again and again, senior managers at the largest private hospital in Victoria were being informed about concerns about this man's care of vulnerable women, and yet nothing happened. What do you say to that?
Well, and that really is why I've written to the Victorian Minister to ask whether or not there should be an investigation into the clinical governance standards and the application of those standards at this hospital.
In December, Simon Gordon removed himself from AHPRA's Register of Practitioners. The regulator's investigation into him continues. Dr. Desiree Yap says she knows why the corrosive culture of silence about doctors like Simon Gordon remains.
I think that we don't have faith that there are good mechanisms for reporting performance concerns. I have spent a career where I have been in a male-dominated environment where career progression was a patronage type of system. Basically, if you're not a team player, you're not on the team.
What's the consequence of that for patients, though, if there are real concerns?
I think it's a big problem for quality of care for patients.
Why do you think this hasn't come out?
I think most of us are scared.
Why is that?
Many of us who've ever, throughout our career, if we've ever tried to speak up, we've often been punished for speaking up. For myself, I am a female surgeon working in Melbourne. If I add the part that I'm a brown female surgeon, then that makes it much more difficult for me to speak up. Louise, I speak today, and we've had a chat about this, that there's been numerous times that you've requested I speak with you, and my answer has been no, because I'm scared that me speaking up could potentially be career ending. It could impact my practice, and it could lead to isolation from my colleagues and from, the greater medical community. I'm willing to speak to you today because it is the right thing to do for the patients that cannot speak.
That's a big thing to do.
And I may be not even comprehending the risks that I am actually taking. And I hope that this will be a changing point for us in medicine, where we do not blame the people that speak up, but we look at how, as a system, we can do better, because our patients deserve better.
These women want that too. They're tired of having to do all the fighting themselves.
I want all of those doctors that knew what happened to speak up.
What would you say to Simon Gordon if he was here today?
I actually don't know what I'd say to him. Sorry.
I wouldn't say anything to him because I don't think I could even look at him.
I haven't had a day of relief since my surgery.
I would probably ask him how he sleeps at night. Like, was it worth it?
If this program has raised concerns for you, you can contact one of these services.